Aloha guys, this is Dr. Tom. I'm coming back at you once again. Yeah, I'm even going to do it left-handed this time. Okay, we're going to talk about the digestive system. We probably can't get it into a single video, so we have to do two of them. So without further ado, the digestive system. The digestive or gastrointestinal system performs four main functions: ingestion, taking in food; digestion, breaking it down; absorption, absorbing the nutrients into the bloodstream; and elimination of undigested waste. Organs. The GI tract begins with the oral cavity, the mouth. In there we have teeth. These are teeth. Okay, let's see. We got the tongue, the teeth. This is the uvula, little thing that hangs down. Hard palate. The back is the soft palate because it's not anchored over bone like the hard palate is. Where's the tonsils at? Oh, it's just showing stuff. Okay. Tonsils are 7. Yeah, here they are. Papillae are the little bumps on the tongue. Teeth, because that is, the teeth are part of the digestive system, guys. So there are 32 teeth in the adult. You got these incisors and then the canines, the little sharp ones here. Can you see that? A couple of premolars and 3 molars, and that's all. Teeth are very important, but it's something I never could get excited about. It's a good thing I didn't try to be a dentist. Okay, part of a tooth. We got the crowns made of porcelain, or enamel, I'm sorry. The dentin on the inside, the pulp, and then here are the blood vessels and nerve roots. Here's the jawbone. Here's the vessels themselves that send the little branches up. Actually, dental problems can be very serious. It can be, potentially can be life-threatening. So it's really important, guys, take care of your teeth. Most of us have a high-carb sugar diet, and that's what feeds the bacteria that eat your teeth away. So be careful with that and keep them brushed and flossed regularly. Okay, there are 3 sets of salivary glands. The parotid gland on the sides, the sublingual, that eat the tongue, lingual, and the submandibular up under the jaw. And these are bilateral, so we have them on both sides. So you need to know that. Deglutition is the term for the act of swallowing. So here's a cross section. Here's the nasal cavities. Here's the tongue, the pharynx. The epiglottis now is closed off to keep this food from going down the trachea, which could be fatal. It can choke us to death, guys, or it can get down into the lung and set up a very serious pneumonia. Here's the voice box, larynx. Now the tube that we swallow food through is called the esophagus. Right here it is. The trachea is anterior to the esophagus, so the esophagus is behind it. You can't directly palpate the esophagus. Here the epiglottis is open for breathing, and it closes off when we're swallowing something. Of course, we all know that sometimes it goes down the wrong pipe anyway. Okay, from the esophagus, it goes down into the stomach. The stomach has 3 parts: the fundus, the body, and I always heard this called the pylorus, but they've got antrum here. I don't remember ever being taught that. There's a sphincter here, and when it doesn't hold tight, guys, it regurgitates up in there, and that's what acid reflux and stuff is. There's a greater curvature of the stomach and a lesser curvature. And then the stomach goes through the pyloric sphincter into the duodenum, which is the first part of the small intestine. The stomach is very strong. It's very muscular. It has a corrugated interior called rugae that helps to mix the contents. It also secretes hydrochloric acid and a number of other products that's essential for digestion. Like I said, I always learned it as fundus, body, and pylorus, but they're called antrums. They're calling this the pylorus. That's different than the way I was taught. Okay, the digestive tract is the mouth, the tongue, the esophagus, which goes behind. Wait a minute, they've got it all. Here's the liver. Here's the stomach. Here you can see the small intestine peeking out. And here's the large intestine, or colon. Now what we're going to learn, guys, there's the gastrointestinal tract itself, which is a continuous tube from the mouth to the anus. But there are a number of accessory organs that play a role in digestion. The liver, the gallbladder, the pancreas are all accessory organs. They have other functions, but they play a role in digestion also. Now this, of course, also shows parts of the respiratory system too. So here's the diaphragm muscle separating the two. Here's the pancreas peeking out a little bit. Okay, so the food goes, after it gets all mashed up, goes into the small intestine. Villi are found in the lining of the small intestine. And what it is, guys, are large numbers of these little wrinkles in there. What it does is it gives it more surface area. Most digestion occurs in the small intestine, so it's super busy. So this gives more surface area with all these thousands of villi to allow digestion to take place. And we have blood vessels and a lymph vessel. Individual is called a villus. Why, guys, you got to have lots of working area for this stuff because it's going to be breaking down foods. Okay, and then from the small intestine, the food goes on. A lot of it's absorbed also into the small intestine. It's broken down there, but it's absorbed there too. Then it moves into the large intestine, which is probably more commonly called the colon. So the first part of the colon is called the cecum. Here it is. There's an ileocecal valve from the ileus, the distal portion of the small intestine, to the colon here. There's an ascending colon, a transverse colon, a descending colon, and then an S-shaped structure called the sigmoid colon. This is over on your left side of your body. Then we have the rectum and the anus. Let's see. Here's the stomach, here's the pancreas. Contents from, or products. The pancreas produces a large number of vital digestive enzymes, guys, and it along with bile from the gallbladder go directly into the small intestine. Now, I didn't mention the hepatic flexure is just the name of that bend right there, or the splenic flexure is just the name of that bend. But you do need to know ascending, transverse, descending, and sigmoid. Rectum. The appendix, you've all heard of that, and known people just had to have it out, is right here. Moving along. Okay, accessory organs, liver, gallbladder, pancreas. Here's the liver, second largest organ in the body. What's the largest organ in the body? Who can tell me? I'm not going any further until somebody tells me. Ah, that's right, it's the skin. Especially in big people, fluffy people. Liver's the second largest. Here's the gallbladder, guys. Gallbladder stores and concentrates bile. Bile is used to break down fats in our diet. Here's the stomach. The pancreas is behind the stomach. It's shaped like a fish, and it runs transversely. And then products from the liver go through the hepatic duct. The gallbladder has a cystic duct, and then they come together in the common bile duct, join with the pancreatic duct, and empty into the small intestine. Here's the spleen also. The spleen primarily, as you know, plays a role more in the lymphatic system. Besides producing bile, the liver helps maintain normal blood glucose levels, manufactures blood proteins necessary for clotting, so it plays a big role in clotting, removes bilirubin, a pigment in bile when it breaks down, removes toxins and poisons from the blood, has to detoxify drugs and alcohol. That's why people who abuse alcohol often have liver problems. Where are we at? Pancreas is the only organ in the body that's both an endocrine gland and an exocrine gland. Produces insulin, which plays a vital role in maintaining and ferrying blood sugar into the cells, what it does. And then various enzymes are its exocrine function, and they go into the duodenum. The pancreas is extremely important. All right, let's quickly go through this. Food pathway through the GI tract. Okay, oral cavity mixes with saliva. Why is that? It lubricates it, but it also starts carbohydrate digestion. We have tylen, an amylytic or amylase type enzyme in saliva that starts breaking down. That's why if you take a bite of bread, keep chewing it, and after a little while it starts tasting sweeter. Why? It's already changing into sugar in the mouth. Then it goes through the pharynx, esophagus, into the stomach. The stomach's where protein digestion begins. Then into the duodenum. The liver, the gallbladder, and pancreas all empty their prized products into the duodenum. It's really important. Excuse me. Then the next part of the small intestines is jejunum, then the ileum. The cecum is first part of the colon. Then ascending colon, transverse, descending, sigmoid, rectum, and anus. All right. Okay, vocabulary, let's see. Absorption, passage of materials through the walls of the small intestine and the bloodstream. The vast majority of absorption takes place in the small intestine. Amino acids, building blocks of protein. Amylase. Anything ends in ASE is an enzyme. Enzymes secreted by the pancreas and salivary glands to digest starches, carbohydrates, sugars. Anus, terminal end or opening of the digestive tract of the outside of the body. Vocabulary, let's see. Appendix, blind pouch hanging from the cecum. Bile, we talked about that momentarily. Digestive juice made in the liver and stored in the gallbladder. Breaks up large fat globules composed of bile pigments, cholesterol, and bile salts. Ah, yes, there's the evil cholesterol showing another its vital functions. It's not the evil satanic thing that they want you to make it sound like, so you'll run out and urge them to give you cholesterol-lowering medicine, in my opinion. Bilirubin, a pigment released by the liver and in bile. Bowel, the intestine, is just a general term. Canine teeth, pointed dog-like teeth. Arr, arr, right there. Also called eye teeth, yeah. Cecum, first part of the intestine, colon, ascending, transverse. Common bile duct is where the pancreas and the liver and the gallbladder and the pancreas all come together. It has one. Defecation, elimination of feces from the digestive tract through the anus. Deglutition, swallowing. That's the word for swallowing. Dentin, part of the material found in teeth, covered by the enamel of the crown, protective layer of cementum in the root. Digestion, breakdown of complex foods into simpler forms. Duodenum, first part of the small intestine, is about a foot long. Elimination, actual removal of materials from the body. Emulsification, physical process of breaking up large fat globules into smaller globules so it can be soluble to water. Soap does that. Detergent does it, guys, for example. Enamel hard outermost layer of a tooth. Enzyme, chemical that speeds up reactions between substances. Enzymes name always end in ASE. That's something quite important to know, guys. Esophagus, tube connecting the throat to the stomach. Fatty acids, substances produced when fats are digested. A category of lipids. Of course, lipids is a chemical term for fat. Feces, solid waste, also known as stool. Like the patient had demonstrated a lactatory stool, which makes them think they have internal bleeding. Gallbladder, small sac under the liver, stores bile. Can you live without it? Yes. Is there a lot of people that's had it removed? Yes. What happens to them after that? Well, from what I'm told, if they eat fat, they better be right next to a bathroom or have an extra pair of pants, or both. Glucose, simple sugar, blood sugar. Glycogen, starch. Glucose is stored. We have glucose is blood sugar, guys. It's essential for life. We have it stored in our body in the form of starch called glycogen. And it's stored in the skeletal muscles and in the liver. And if our blood sugar starts falling, then the body mobilizes that and breaks it back into glucose. Hydrochloric acid. The stomach has acid, as you know. It's very important. It's about the same strength of acid as what's in your car battery, so it'll burn you and all. That's why it's so painful if you belch it back up or regurgitate it back up. But it's absolutely vital because it starts breaking down proteins. Doesn't say that here. But also, guys, it helps acts as a disinfectant or a barrier against infection. Yes, it's supposed to be highly acidic, and it needs to be highly acidic. And if it's not, you can have problems. Okay, we're going to have to start on, continue to another video. I'll see you in a moment.